My name is Dr. Adam Farber, and I would like to talk to you today about tennis elbow, also known as lateral epicondylitis. In order to understand tennis elbow, you must first understand normal anatomy of the elbow. This slide has two pictures of the bones of the elbow joint. The image on the left is a view of the front of the elbow, and the image on the right is a view of the back of the elbow. The elbow joint is composed of three bones. There is one bone in the upper arm known as the humerus. The red arrows point to the humerus. The forearm is composed of two bones, the radius and the ulna. The bone on the outside part of the forearm is called the radius. The blue arrows point to the radius. The bone on the inside part of the forearm is called the ulna. The green arrows point to the ulna. Tennis elbow is also known as lateral epicondylitis because the area of abnormality occurs at the lateral epicondyle of the upper arm bone. The blue circles in this slide enclose the lateral epicondyle. This slide shows a picture of the back portion of the forearm with the muscular anatomy of the elbow clearly depicted. The numerous extensor muscles share a common tendon which attaches to the muscle to the bone at the lateral epicondyle, which is again enclosed by the blue circle. Tennis elbow is a condition in which the common extensor tendon becomes degenerative in the area where it attaches to the lateral epicondyle. This picture shows a close-up view of the common extensor tendon attaching to the lateral epicondyle. This slide shows another picture of the common extensor tendon attaching to the bone at the lateral epicondyle. The area enclosed in the blue circle shows the degenerative appearing tendon, which represents a process known as lateral epicondylitis, or more commonly, tennis elbow. This slide shows the appearance of a normal common extensor tendon versus an abnormal tendon using ultrasonography. The image on the left shows a normal tendon enclosed in the green area attaching onto the bone edge of the lateral epicondyle marked by the red line. The image on the right shows the ultrasound appearance of tennis elbow. The abnormal tendon again is enclosed in the green area attaching onto the bone edge of the lateral epicondyle marked by the red line. The yellow area points to the degenerative portion of the tendon. Tennis elbow typically results in pain on the outer aspect of the elbow and forearm, as shown in the red area in this picture on the right. The pain is typically aggravated by repetitive use, lifting, and gripping activities. Frequently, patients report difficulty with activities such as handshakes, turning doorknobs, or unscrewing jars. Treatment for tennis elbow typically starts with a conservative non-operative approach. Avoidance of aggravating activities combined with icing and anti-inflammatory medications such as Advil or Aleve are typically recommended. In addition, stretching and strengthening exercises are beneficial. The image on the left in this slide shows a series of typical stretching exercises that are useful for patients with tennis elbow. The image on the right shows a series of strengthening exercises which I recommend for patients with tennis elbow. In addition, a tennis elbow strap known as a counterforce strap is often recommended for patients with tennis elbow. The strap should be worn while performing potentially aggravating activities. The strap helps to unload some of the tension off of the diseased tendon and therefore alleviates pain. This image shows a typical tennis elbow strap placed in the proper position. In addition to the treatments previously mentioned, oftentimes a steroid injection given into the area of the degenerative tendon can be very beneficial for alleviating pain and discomfort. This image shows the injection being performed under ultrasound guidance to accurately place the injection into the area of the diseased tendon. I perform this technique in my office using ultrasound equipment. Recently, a treatment option known as PRP, or platelet-rich plasma, has become available as an alternative to steroid injections. Normal human blood contains platelets in addition to water, red blood cells, and white blood cells. The platelets contain a variety of growth factors which aid in the healing of damaged or diseased tissue, such as tendons. The idea behind PRP is to draw a specimen of normal blood from the patient and then place it in a centrifuge so that the different components of the blood separate based upon their density. The platelet-rich layer is then isolated and re-injected into the area of the diseased tendon to stimulate and jumpstart the body's natural healing response. Several recent studies have shown that this technology is more beneficial in the long run as compared to steroid injections. If none of the above treatments are successful, some patients may require surgery to treat their tennis elbow symptoms. Only 5 to 10% of all patients with tennis elbow eventually require surgery. During the surgery, the diseased portion of the tendon is excised and bleeding is treated to stimulate a healing response, much like the PRP injection. picture on this slide shows the diseased tendon visible through a small incision. For further information about tennis elbow, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com. Thank you.